It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor, we bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yunji Denise and Ryan Pelesuji on the digital platforms of the Honolulu Star-Advertiser.
Well, happy Aloha Friday. Thanks for tuning in here to Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. I'm Ryan Pelesuji, joined by Yunji Denise. And this morning, we will be featuring a guest that we haven't had on the show before, and also somebody who is assuming a new office that has been created specifically by the legislature and someone that has just been appointed by Governor Green.
That's right, a fresh face at the legislature and, of course, a fresh face on this show. We welcome this morning Tia Roberts Hartsock. She's the executive director of the Office of Wellness and Resilience. This is a very interesting office, and we're so excited to have you on this morning. Thanks for being here.
Aloha. Thank you so much for having me.
So let's start with the nuts and bolts for folks who aren't familiar. What is the Office of Wellness and Resilience? What's the mission? And tell us about what you're hoping to accomplish.
Sure, thanks. We're brand new. It was an office that was developed through legislative sessions last year in 2022. It had bipartisan support throughout the legislative session and really was birthed out of a huge collaborative a community effort through the Trauma-Informed Care Task Force that has been happening to create a framework for the state to implement trauma-informed care. And when this legislation was introduced, we were really looking to try and have a coordinated response to how we look and approach trauma, how we respond to people that have experienced traumatic stress, and all kind of under the guise of the COVID pandemic. It has just been exacerbated, these pieces in our community. So we really wanted to be able to address it full force and get in front of and around the improvement and the wellness and resilience of people's mental health in the state.
Let's talk a little bit also about just the difference between this department and your office and what you're looking to accomplish, as well as others that have already been established. Of course, there's the Department of Health that would kind of overlap with some of these things that you're talking about, the Department of Human Services. How is this different from the services that were already provided in already established department, and why there was the need maybe to create something this specific for this cause?
Yeah, I think the overlap, there is some overlap, there is some coordination, but as a kind of looking at a 30,000 foot view, there's several reform efforts that are happening and that have been happening in the state around trauma-informed care for several years, both within the state level, on the federal level, as well as on the community nonprofit base. And what one of the primary aspects of the office is going to do is really look to coordinate those efforts so that we're able to understand what's happening out there, where the overlap is, where the gaps are, where the pukas are in those system structures, and be able to help find funding support from federal funding to state funding, and hopefully use the office as a bit of an incubator to help support the efforts that are happening throughout the state. The other piece is to really look at having a centralized body to do training and technical assistance on building resilience within the workforce, building mental well-being throughout and with trauma-informed care strategies, and provide coordinated training across the board, across the state departments, and within the community on how to best approach and respond to trauma.
And just so that we're all, speaking the same language, what is trauma-informed care, and how, when you use that kind of language, I think a lot of people think about therapy and don't necessarily think about workplace wellness and how that all fits together. So just sort of the basics, what is trauma-informed care, and how is that applied in the settings that you described?
To me, it's really looking at how we recognize how to interact with each other specifically when people are coming from early adverse experiences as children and how it plays out with later in life health disparities. And depending on how you look at it, we have many adults that are living through at least one traumatic experience in their lifetime. But when we're looking at people that are involved in our system structures, like the mental health system, the judiciary, juvenile justice, criminal justice, the child welfare systems, the adverse experiences of those folks are multiplied, not just from being from their communities and how we experience collectively and historical trauma, but also in individual trauma and experience with interpersonal trauma, witnessing neglect, witnessing violence. But being trauma informed really looks at recognizing the prevalence of that trauma and starting with that concept of adverse experiences as children. And again, it ranges from witnessing violence, but it can also be like medical traumas, right? And having those within communities and within families, and how that has a long-term prolonged effect on people's ability to regulate emotionally and their ability to show up for work, their ability to be present and balanced, their ability to learn in environments like school. If we have stressed brains, it's very challenging to concentrate and remember. And so that has an impact on the way in which we learn, even just as humans.
Just want to also give some context into just how this position and this department was created. Of course, Governor Green, you were appointed by this administration, but this is something that was approved prior to Governor Green even coming into office. And so this has been some years in the work prior to this administration coming on in November. If you can give some context into how this all started, where this conversation began to form this department, and how it eventually led to where you're at now.
Sure. So again, this is it's been a couple of decades of work, of people's work, that has led to this, in my opinion, within the trauma-informed care field, within the work of mental health, and as it overlaps with child welfare experiences and criminal justice experiences, system involvement, what we call crossover youth, crossover families that are multiple system involved. And the need for this has been on a grassroots level. It's been in nonprofits, but the task force that was developed in 2021, the Act 209 Trauma Informed Care Task Force, was developed out of session laws, and it was this. There's 11 members on that, representing most state departments, child serving and family serving, along with nonprofits and other community organizations that provide support to youth and families. And the office was, as I mentioned, created to really pull together collective voices in the community that were seeing the need rise from the COVID pandemic, and really understand that what we're starting to see already is just going to be multiplied. And as we've gone over the months now, and are technically in post-pandemic mode and a post-pandemic world, we're continuing just to see this rise in not only traumatic experiences that happened during the pandemic, but that are learning lost opportunities to grieve during the pandemic, to celebrate during the pandemic, to come together and connect during the pandemic, continues to kind of show up in what we look at social determinants of health, and what we look at how workforce wellness and resilience is kind of trying to now come back to a world and address how we're supported in our everyday lives.
I mean, it's so interesting to hear you talk about that. I was reflecting so much because, of course, May 11th and so much of the coverage was focused on, oh, the pandemic's over, and thinking about what these last few years have been like. I think to varying degrees, we've all experienced some pretty tough times and a lot of fear and anxiety, a loss of work. Those of us who are parents, very concerned about our children.
Right.
How prevalent do you think the kind of trauma that you're talking about is? And, you're an office, I believe, of about 6 people, and surely you can't address all the trauma in our community. How do you prioritize that? What kind of qualifies? How do you determine where to focus your efforts?
Well, as we were developed through many, many hands, getting this legislation through, and prior to even introducing legislation for this, it will be the same effort moving forward. Utilizing system partners that we have developed over the years, utilizing the task force members within their own departments and organizations to continue to collaborate. It's going to be this, a very much a Kakou effort. It's going to be a collective effort to move within the communities, identify the needs, identify the barriers, and to see how we can move forward through really building resilience. There are many things that are working within our communities right now that build resilience. INA-based programs, connecting to cultural practices and activities. And so part of the office is also looking at uplifting those practices and seeing how we can replicate and support those practices that are showing a lot of promise in communities to build the concept of connection. To not only connection to self, not only that, but connection to a family, connection to communities, and really looking at it across the lifespan, the Keiki Tukapuna concept of understanding what mental wellness really needs to look like. And I will specifically kind of note that as we've gone through the pandemic, we've seen, even prior to the pandemic, we've seen a need for more staff in our systems, shortage of staff. But since the pandemic has happened, this nationwide concept of the Great Resignation is, of course, affecting us here as well. And we have this concept where now that we have more need with less people in the workforce, and recruiting and retaining healthy staff and supporting them as they're trying to navigate not only their own pieces of what they've experienced over the last few years, but now trying to respond to the increasing need of the communities and the public around their wellness and resilience as a community.
When you think about it, there are so many different areas of state departments as well as other functions of government that are impacted by trauma and some of the things that you're expressing. We have a question here from Heidi who's asking, will this division working with the houseless community, hospital releases, and creating a safe release process? The governor has been very vocal about his commitment to homelessness, of course, setting up the Kauhale across the street from Queens Hospital to help directly deal with those individuals who may be needing assistance in other care beyond just getting a house, but just human services, counseling, other types of services. How is this department related into some of those efforts?
Yeah, thanks for that question. We are in the office of the governor, as is the houseless coordinator and James Koshiba, who I think you're having on tomorrow. So we coordinate with each other on a regular basis. One of the other pieces that I'm really interested in implementing throughout our system's responses to social needs and barriers within our systems is doing so with a trauma-informed kind of response. So implementing the principles of trauma-informed care that include collaboration, right, safety, but really look at the concepts of empowerment and voice and choice in everything that we do. The big piece that we're going to see that we've already seen in our systems, but the big piece around the anxiety in the community right now is predictability, helping inform the way in which we communicate as a system and as a government, to be able to provide predictability. One example is I'm working pretty closely with the emergency response coordinator for our state, and trying to look at ways and areas where we can insert trauma-informed care concepts on how we get ready for a natural disaster, how we are able to respond and predict what's happening next, so that the community can help around the lowering anxiety in the public to see what's coming next as much as we can. Here's what we're going to do now, then we're going to do this, and then this is likely going to happen. This is the timeline for it. It's the constant communication, the constant getting out of information, and as much as we can help to provide predictability, and to, so that people know what to expect next, is going to be one way. So the crisis, we're working on a crisis hub right now. I actually just left a meeting to come for this. It's a multi-pronged effort with both the state and philanthropic organizations and nonprofits to look at standing up a crisis hub and multiple crisis hubs across the state to kind of work as an emergency room, but specifically looking at mental health crisis.
I'm interested in that. What would that actually look like? Would that be in a hospital, or would be a standalone facility? What would a crisis hub actually be?
Well, we're trying to identify a space right now, but it would look similar to an emergency room. There's a couple of crisis hubs that have been set up around the country, on the continent, that we visited, and we're trying to take elements of it to see what would be helpful to apply here. But it looks like that what we've seen in practice, it looks a little bit like an emergency room type of setting, with ability to respond immediately to help stabilize folks that are experiencing mental health crisis, active psychosis, and as it relates with medical need, that can be also addressed, but the specific focus is going to be looking at mental health crises that are happening. So people can either, what the concept is, right, is to look at providing a specific space to have folks come in that are needing mental health support immediately.
I want to go back to something you mentioned earlier about, identifying some of these things that may exist within the workplace, within state government. You had also mentioned in schools and such, and just a lot of it also being impacted by the pandemic. But just for example, just to give us context into how this is implemented, say there is a state department and there are individuals that work within a department or an organization within the state government that are suffering through some sort of mental trauma, experiencing need and assistance. What would that logistically and tangibly look like? Would that include someone from your department then reaching out to these individuals to get them connected with care? Would it be, a list of mental health providers? How would that all shape out so that the access to these needed services are implemented?
Well, there's a couple of, and we're strategically thinking through this right now. I just recently got staff on board, and we're about to get 2 more staff on board. So I've finally been able to do some strategic planning for the office to see exactly how we're going to do that, and as well as been talking to task force members and other organizations across the state on how that might look. But there's a couple of programs that we think might be very helpful to implement. We have the employee assistance program throughout the state, and that's something that employees are able to access now and have been able to access for many years. And that looks like one-on-one support through the EAP program. However, what we'd like to do is build sustainability within the system so that supervisors are trained up and supervisors can support within the branches and the divisions and the departments, so that we have this ongoing ability to respond, so we don't wait till it gets to the point where people are in crisis mode, but it's this ongoing effort and campaign to identify when yellow flags go up for us to be able to be aware enough as employees to say when we will need support with early signs of burnout, with early signs of vicarious trauma, with this ongoing exposure to secondary traumatic stress. So different types of elements and strategies that we're looking to implement to early identify staff that might need more support. And, there's a huge body of research out there that talks about the effectiveness of peer supports in our systems. So we don't want to only rely just on the state. We don't want to only rely on therapists and mental health professionals because we need to build that workforce up very much so right now. But we want to value and recognize the knowledge of people that have lived experience and how they can provide support within our systems. So integrating peer supports throughout our system, I think, is going to be one of our focus areas as well. But the sustainability piece, again, the state can't be, the state is not the answer to every of these questions. So our ability to collaborate and reach out to what's happening well and what's effective and what we've known, the ancestral knowledge that's out there, that what we've known for many generations that has worked to create resilient communities needs to be recognized and uplifted and supported as well.
It's so interesting because it really feels like you're talking about a real shift in sort of the culture and the thinking of how we view workers, how we view each other, how we view community. I wonder with efforts like this, how do you measure success? Because those kinds of cultural changes and what you're talking about, they can take a very long time I would think, to actually get into practice. So in the short term and long term, perhaps, how do you measure success from your office?
Yeah, we're talking about systems reform, and anybody who does systems work knows that this is a marathon. This is a long game, and so there are long-term outcomes that we're going to be identifying. We're developing a social determinants of health dashboards that was in the legislation. So we're on our way to creating and identifying the variables that will be helping to inform that. However, I think in the short term, one of the things that I'd love to see as a measured outcome is a higher satisfaction and acknowledgement of where the focus needs to be around resilience within the workplace. So asking the questions, like even surveying staff on a statewide level to be able to say, how are we doing as a state? How are you doing as an employee? What kind of support do you have? What do you need? What do you think the barriers are in your specific program, your division, your department, your branch, that you might identify that we could help respond to? But primarily and initially asking the questions, I think, is going to be really helpful. But when we ask questions, we want to make sure that we are prepared to come up with some solutions collectively. So we don't want to ask the questions and then we say, oh, thanks for the answers. Thanks for answering our questions. See you next year. We want to be able to say, ask the questions and be able to immediately respond and have resources available and identified prior to doing that. So we're going through this strategic planning piece with a lot of conversations with both community leaders as well as academic folks. We're developing contracts with a couple of universities right now to assist with what that might look like. So measures around, can we better recruit? Can we better retain? And can we better support employees that are providing the service to the public? So a lot of our programs and our departments are looking at focus on providing the service to the families and youth and adults in our systems and in our communities. And we're trying to kind of take that step back to say, how well are those people who are providing the supports supported, and how balanced are they, and what are their needs? Because if we have unbalanced staff, it's that don't recognize when they're burnt out or what their needs are, or how to come to this work fully present for the folks that we want to serve. it's a little bit more difficult to provide solid services and supports for youth and families, and to be able to identify really what that means for the end, user.
When it's never easy to be the first of anything, right? Because you are establishing something from the ground up, and not only are you the first in this position, but this is the first of its kind of a department in state government in the entire country. I'm wondering how you're going through this process of putting this all together, also recognizing that there isn't other models out there that you can really pull from, or maybe there are different states that have something similar, but included within another department. How are you frameworking all of this, just being the first in this role?
Yeah, it's there are other jurisdictions that have created offices of trauma, offices of wellness, offices of resilience, and they're kind of nested within Department of Human Services, those types of departments of health. There are one-person positions in some governor's offices that are like looking to address as a coordinator position. But as far as we know, this is one of the first, if not the first, office on a governor level to have multiple staff to address this. And so I've been in contact with several other states and federal organizations that have created strategies and frameworks that are implementing similar efforts. But, a lot of the federal government agencies are very interested in what we're doing because of the unique opportunity that we have to do this with a focus on to have a cultural foundation to do this work. How are we utilizing practices that have been successfully building resilience in communities for generations, and building upon those. So we're uniquely positioned to come up as a lead in the country to look at how to utilize indigenous knowledge to inform these practices. But yeah, it is exciting, and it's also slightly terrifying to do this with many, ideas about how this can be implemented and operationalized in systems. So it's very exciting, and what an unbelievable honor to be a small part of this effort. But I am very, very interested in continuing this piece and pulling community knowledge together to both learn and grow this office collectively.
We are almost out of time, but I want to give you an opportunity to share a final thought with our audience this morning. And, when you talk about that, we rarely, I think, hear Hawaii getting to be at the forefront of something like that. What do you think that says about our state and the priorities of our leadership, that this is, that this is brought to that level?
Right. So, how lucky we are to live in a state that the administration, prioritizes wellness and mental health. We've had champions in the Senate and both the Senate and the House. This was primarily championed by Senator Dela Cruz, but has also been supported by many legislators as it was developed. And then when Governor Green came in and has really created this as a priority for his administration, it just has created such an amazing opportunity for us as a state to really prioritize this and bring the conversation to these levels. And having this during Mental Health Acceptance Month is very timely in that as well. So it's a humbling experience, and a very exciting one as well.
And before we do let you go, I just want to allow, if people are learning about this for the first time, if they want more information about the services you provide, or just anything in general to get more information, how can people get connected with you or within the department, or how can they learn more information about it?
So we can go. People can go to the governor's website. There's a piece on the office there. We are starting to develop we have started to develop content to provide more information through that. But we also have an email, and it's gov.owr@hawaii.gov. gov.owr@hawaii.gov. And so that's a general email that will go to our office, and we can respond.
Fantastic. Okay, well, Tia Roberts Hartsock, Executive Director of the Office of Wellness and Resilience, thanks so much for coming on this morning, for explaining the office, and we look forward to catching up with you in the coming months to see the progress of what you've done. Thank you so much.
Thank you so much.
Wow, Ryan, very interesting, to hear about the progress that they're already making and how this all came together. We did experience a lot of collective anxiety, and some would describe it as trauma over the last few years, going through all the lockdowns and all the stress that the pandemic, brought on. But beyond that, you really heard her talking about trauma that people have experienced in their lives, a lot of childhood trauma that they're focused on that can then have very negative outcomes as adults. And interesting to hear how they're trying to use that mental health piece in recruitment, retention, making sure that, people's lives are better as they are workers. And then also talking about those potential crisis centers that we could see something like that in our community. That would be very exciting as well.
Yeah, and something that would allow individuals, if they are in a state where they feel like they need support or assistance, could go to, whether it be housed in a hospital or some sort of medical facility. Those are some things, as she said, that they are working on. And also just really trying to get a pulse of employees about how they feel coming to work and what services they are currently being provided, services that they feel that they'll continue to need. That's going to be something that will also be a measurable part of this department to just kind of gauge where workers are at. But when you hear from her too, there is a lot that could fall into this department as it's pretty broad. And of course, many departments and many people who the state would ultimately want to service. But you also heard her say that it's about systems as well, that the state government can't be everything to everyone, that they're not going to be able to provide these counseling services or services in general for every single person that may be experiencing this. So how do they really start from the ground to ensure that there are systems in place, that there are individuals, whether it be peers or trained professionals, that can assist in these efforts and identifying them at an earlier point before it gets to any sort of crisis mode. So there is a lot of foundation that is being laid as this new department gets started.
Yeah, and as she noted, we will be talking to James Koshiba on Monday, and he's also going to be joined by Nani Medeiros, who's the Chief Housing Officer. Of course, James Koshiba is the governor's coordinator on homelessness. We'll be asking him about how the work that Ms. Hartsock is doing helps with his department. The conversation on Monday, we're really focusing in on Kauhale. The governor has laid this out as a big priority for his administration. You saw just this week the buildings going up right by the Department of Health across the street from Queens Hospital, from that emergency room, so that, the governor has said he doesn't want to see those folks laid out on the street after they're discharged in the emergency room with no place to go. This is supposed to be a stopgap measure to help get those folks services and to end that cycle. So we're going to be talking to them about Kauhale. The governor's saying he wants 26 of these across the state. Where else could we see these? And how will the community have an opportunity to suggest where the sites could be? We're going to be taking a deep dive into Kauhale on Monday, and we do hope to see you then.
Have a great weekend. Happy Mother's Day to all the mothers out there. Happy early Mother's Day to you, Yanji.
Oh, thank you so much.
We'll see you right back here on Monday. Aloha.